It's my feel-good breakfast show.
Welcome back here on your Feel Good Breakfast Show. Expresso right here on SABC3, getting into your baby talk this morning. That's what we reserve our Thursdays for. And it's a rather serious conversation we're having right now. Birth defects, they are a significant cause of child mortality. Now, they impact millions of families, and a sustained focus is really needed to support research, prevention and treatment. Now, March the 3rd, 2019 marked the 5th annual World Birth Defects Day. And this year's theme is Many Birth Defects, One Voice. So here to help us unpack the significance of World Birth Defect Day is occupational therapist Meg Faure. And as always, our lines are open 021 430 9881 if you want to weigh in on this discussion. Thank you very much, Meg. Hello, how are you?
Hello, Ian. Good, thank you.
Good. I think let's dive straight into it. What are the main causes of birth defects?
Well, I think you could break it down into three main areas. Things that happen before you fall pregnant even, things that happen during pregnancy, and then things that happen at birth. So examples of things that would cause birth defects before pregnancy would be chromosomal disorders, so things that are actually carried in your family genetically. That would be an example. Deficiencies of certain things in your vitamins and minerals, and also if you're not immune to certain diseases. So those are things that are kind of happen before you fall pregnant that you can take care of. Then during pregnancy, there are certain things that we do or don't do that really can lead to birth defects. Things like, for instance, drugs and alcohol, that type of thing. Yeah. And then, of course, something happening at birth can also lead to birth defects. Like if the baby has no oxygen at birth, that could lead to a birth defect.
Yeah. So there are some things that parents then can do to avoid it. It was just to highlight the main things again. I mean, if you want to kind of try and eliminate that before you fall pregnant.
So if you haven't fallen pregnant yet, it's very important, first of all, that you might want to have genetic testing done if your family has had a history of anything untoward with one of the other kids, for instance. Secondly, you are going to want to make sure that you are healthy and fit and not drinking alcohol or taking drugs. You're going to want to see your doctor to have certain tests done. So, for instance, are you immune to things like German measles or chickenpox? Because both of those can cause birth defects, like, for instance, deafness, for instance. And then you're going to want to make sure that you're not on certain medications. So there are medications that you need to come off before you fall pregnant. So that's what you do before you fall pregnant.
Right, okay, cool. Well, it's good to know that there are a couple of things that you can do and can think about before you fall pregnant. Alcohol fetal syndrome, not only, I think, a big problem in South Africa, but the world over as well. What exactly is that? What does it entail?
So we actually have the highest incidence in the world here in Cape Town, which is absolutely tragic. It probably has something to do with the wine farms around the area and the way that people were traditionally paid in the DOP system. Fetal alcohol syndrome is absolutely tragic. Alcohol is known as a teratogen, which means that it's actually poisonous for the developing brain. Sure. It's one of our biggest poisons for the developing brain. And almost any levels of alcohol in pregnancy can expose the baby to brain defects. And that would then obviously cause things like mental retardation, particularly. We also have something called fetal alcohol effects, which is when you're drinking not enough to really damage the brain, but to cause little effects to the brain. And that can cause things like attention deficit disorder, for instance. So, I mean, the message to moms when it comes to alcohol is absolutely straight. Alcohol is a poison for your developing fetus. You must not drink it in pregnancy. Okay. What's difficult is that we don't know exactly what level of alcohol causes the birth defect. Right. So some moms think, okay, I can just have my 1 glass of wine a day or my beer, 3 times a week or whatever it is. But in actual fact, we don't know what level it is for your developing fetus. So the best rule of thumb is absolutely no alcohol during pregnancy. It's 9 months of your life. Please avoid it.
Yeah, and I think that's a very important point to note because, like you rightly said, you can go, but it's really a personal thing, and we just don't know.
We don't know.
So the best way is to avoid it completely. All right, perfect.
Absolutely.
Meg, thank you very much. If you have any questions, our lines are open. This is a rather serious discussion. We're talking about birth defects. 021 430 9881 is that number to call if you want to maybe give a comment or ask a question to Meg as well. You're more than welcome to connect with us right now. Our lines are open. Call us. We're going to be back with Meg in just a little bit.
It's my feel-good breakfast show.
Welcome back. We are still here with Meg Faure, our occupational therapist, talking about birth defects in our Baby Talk segment. Of course, the 3rd of March of this year marked the 5th annual World Birth Defects Day, and we're talking about this very important topic. Once again, if you want to give us a call, 021 430 9881. Meg, thank you very much. In fact, we have a caller from Joburg this morning. Good morning.
Hi there.
Maggie, how's it?
Hi, fine and you?
Good, thank you. What's your question or comment for
Good.
Meg?
My question is smoking before you fall pregnant and also smoking during pregnancy. How dangerous is it to the baby? Or, I just want to know that, please.
Okay.
Yeah, that's a really good question. Smoking per se doesn't cause birth defects, so it is not fabulous for your health, and it's certainly not good for your pregnancy in total, but it doesn't actually cause birth defects. It is one of the drugs that doesn't, but it can cause low birth weight babies. So, I think the rule of thumb is if you're smoking before pregnancy, give up so that you can have a really healthy pregnancy. If you're smoking in pregnancy, try and stop, but ultimately it doesn't actually cause birth defects per se.
All right. Maggie, thank you very much for your question. I hope that helped as well. I think it leads right into my next question in terms of safe kind of practices that you could put in place to prevent things like birth defects or problems arising. What would you say are some of those important factors that you need to look at, what you need to put in place whilst or maybe before and during your pregnancy?
Yeah. So actually our most common birth defect is actually cleft palates and spina bifida, which are completely avoidable because you just need to take folic acid. So that is an absolute basic.
Folic acid, wow.
Folic acid is very important, and we actually recommend you start taking that, and I think it's 400 micrograms before you even fall pregnant, so leading up to the pregnancy. So that's avoidable, and it's a good thing to do. And then, of course, there's certain tests that you can have done during pregnancy to just make you aware of any birth defects. And those, many of those tests are done routinely, like your ultrasound. That's looking for quite specific little birth defects and growth and so on. And then you've got your tests that happen intermittently through pregnancy. One of the kind of biggest ones that gets done is the quad test. And if something is picked up there, you can go on and have an amniocentesis, to really have a look at the chromosomes if there's concerns around the baby and the fetus.
Meg, we've got another call on the line. Vanessa from Cape Town. Hi, Vanessa.
Hi, Ewan. This is Vanessa speaking. I've got a condition called Arnold-Chiari malformation, type 1, with syringomelia. I know it's a hell of a long thing. I was born at 8 months, and at the time they told my mother, she gave birth, I'm getting emotional. She gave birth via cesarean section, and they told her it's either or me, and we're both still alive. I'm 50-odd, and she's 70-odd. And I'm now disabled and partially paralyzed as a result of my condition.
Sure.
So it's a hell of a thing.
Yeah.
Vanessa.
I would like to know how does this condition affect my mortality, because it's now affecting my mobility terribly.
Yeah.
Well, thank you first and foremost for sharing, Vanessa. Really appreciate your call.
And I think you can really hear in Vanessa's voice the pain of things that come from before birth, the things that are unavoidable that you're born with, and the pain that causes both to the mum of the baby who has the defect as well as the person's life, long term. I can't say, because I don't know what that syndrome is, what life will hold for Vanessa, but I think it's important for us to realize just how important it is to be aware of birth defects and avoiding them.
Yeah.
So,
Vanessa, thank you very much for sharing. We share with you this morning, appreciate it, and it just goes to show how important it is for a mother and as a couple to take care of each other and their health, before and during pregnancy, just to kind of, avoid things like these. And I think it's really, really important as well. What about people wanting to have babies when they're a little bit older as well? I mean, does the risk increase of things like birth defects?
Yeah, so the risk of birth defects definitely increases with age for a number of reasons. Our eggs aren't quite as fresh as they were when we were 25, when we get to over 35. So you're considered to be an older mom if you're over 35, which seems completely irrational because 35 is young. But certainly as you get over 40 years of age, you definitely are having higher risks of birth defects. One of the other reasons is that you have a higher risk of multiple pregnancies, of having twins and maybe even triplets. And the more, and multiple pregnancies hold a risk of birth defects higher than singleton pregnancies as well, because of the birth process and how early those babies are often born. So premature birth is also linked to birth defects.
Well, like I've mentioned, it's a very big discussion this morning. We have another caller from Gauteng, Nelia, I presume. Nelia?
Yes, good morning. I'm on the line.
Good morning, good morning. What is your question or comment this morning? Thanks for calling.
My question is, I've got an adopted baby. Well, she's now 7 years old. A mother used while pregnant crystal meth drugs. She was diagnosed with ODD.
And I just want to make sure because it's getting better, but yeah, sometimes it's very bad.
Yeah.
Yeah. So,
If
I
you
mean,
can give me an answer on that.
yeah, I'm not familiar with ODD. Do you have the full name of that?
What is the full name, ODD?
This is when they get all these aggressive outbursts, and we had to go for parenting
Yeah.
because we had to learn not to be, our faces had to show
Yeah.
not aggressiveness or anything because it seems like they get sort of a panic attack and then they attack you.
Yeah.
Okay, I see.
Yeah, so I mean, first of all, I mean, crystal meth is obviously one of the drugs that you absolutely must avoid during pregnancy, and that will cause some difficulties. And certainly for her, that is what has come through.
Yeah.
You know, I think the most important thing now is to love her and to manage her behaviour. And it sounds like you're getting the help in terms of you know, the therapy and so on. And that really is what's most important. I think at this stage, you know, at her formative stage, she's 7 years old, what you're putting in place now is actually really what's going to make the difference through the adolescence years.
Yeah.
So very important what you're doing and, you know, and loving her and being
Yeah.
a, you know, contained family unit.
But I really do think that you are doing the right thing for going to, you know, counselling and parenting and seeing how you should respond to that condition as well. So well done for that. Keep up. And just like Meg said, keep loving her as well. Meg, thank you very much. You can see that there's clearly a lot of people affected by birth defects, you know, whether it is their own child or, like we've also heard, adoptive children as well. So, yeah, it just becomes absolutely imperative how important it is to take care whilst pregnant.
Absolutely. There's
Take
no
care
doubt.
of what you put in your mouth, what you eat. Folic acid as well, like you said, is a big one as well. Meg, thank you very much. Really appreciate you giving us all that advice. That's your baby talk for your Thursday morning. And once again, thank you very much for all the callers as well that connected with us.